All right.
You're on.
All right. So perfect. I think I'm on. Thanks everybody for joining me on this Facebook Live event. This is Dr. Jung Park transmitting live from Doylestown, Bucks County. Before I get started, I hope every one of you and your family is doing well during this COVID-19 pandemic. This is a very serious problem that is affecting the entire world, and we all need to do our part. We need to stay home, keep our social distance, wash our hands frequently, and really take care of our hands. And that is a topic today. And we have to do everything we can to prevent from contracting the virus. First, allow me to introduce myself. I'm a board-certified, fellowship-trained orthopedic surgeon with subspecialty certificate in hand surgery. I have been part of Bucks County Orthopedics since 2013. Gosh, it has been already 7 years. We are an orthopedic subspecialty group that has been serving Doylestown and the surrounding area for over 40 years. We currently have 11 physicians and 6 physician assistants, and we are a growing practice. Collectively, we cover pretty much all subspecialties, including pediatrics, spine, sports, joint replacements, and foot and ankle, and hand surgery, which is my subspecialty. We are dedicated to serving our community. We introduce services such as the same-day joint replacements and wide-awake surgery, which I will elaborate further in a little bit. Today, I'm planning on answering your questions, busting the myth about carpal tunnel syndrome. We have been collecting questions on social media platforms since the beginning of the week, and during this live feed, you can submit your questions, and I will answer them as we go. For those listening live, please submit your questions anytime. I have my trusty assistant, CEO of PCOS, Randy Gross, about 10 feet away from me, definitely more than 6 feet away from me, taking those notes and questions from you guys. Before we get to the more specific questions, I am going to provide a brief Q&A of the most common questions that I hear in my office. First, the question is, what exactly is carpal tunnel syndrome? To answer this, we have to understand what carpal tunnel is. When we look at it anatomically, it literally is a tunnel with the floor and the side walls that are made out of a bone, and there's a roof, which is a thick ligament. Inside that tunnel, there are 9 tendons and the median nerve that travel. All these structures come from the elbow through the forearm, crosses the wrist, and then spread into the hands, into the fingers of the hands. As you can see, the wrist is the thinnest portion. It is a bottleneck. It is a very confined space. Anything that causes a space to become even smaller could cause compression of the structures inside the tunnel. The median nerve is a structure that is most sensitive to compression and can cause symptoms such as numbness, tingling, pain, and weakness of the hand. Symptoms tend to get worse with any activities that causes further compression inside the tunnel. And this could be having the wrist flexed like this for a long time or extended like this for a long time. Another question that I get frequently is, how do I know if I have carpal tunnel syndrome? It is diagnosed by a combination of history from the patient, physical examination, and nerve studies. The nerve study is performed by a physician, usually a neurologist or a physiatrist. They will place electrodes along different lengths of your arm and see how fast and the time it takes for your finger to respond to a small electrical stimulation. The study confirms the suspected diagnosis and also tells me how severe it is. Now, once you know that you have carpal tunnel syndrome, the next question is, what are the treatment options? There are many different treatment options, and it really depends on the severity of the symptoms and the findings on the EMG. For mild to moderate carpal tunnel syndrome, we have many options, such as exercises, using a brace at nighttime, steroid injection, or surgery. For severe, long-standing symptoms, surgery might be the only option or the best option. Now, something that we can all do from our house or from our homes is some exercises. Now, this is also a question that I get a lot in the office. What exercises can I do? And for this, I would like every one of you to do this together with me. So first, we have to sit upright or even stand up. And then now we can start by relaxing our neck and the shoulder. Try to bring your shoulder blades back as much as you can and stretch your neck in all directions back. I felt a crack. I don't know if you guys heard it. Move your neck sideways. And now we can also combine the stretching of your arms and the hands, okay? But the reason that we have to stretch our neck and the back is because all the nerves come from the brainstem through the neck, through the arm, and then branches into each of the fingertips. Okay, so it does make sense to incorporate the neck and the shoulder into our stretches. Now we can combine some of those things. We can bring your elbow up straight, or I'll show you here. Bring your elbow up straight and bring your fingertips back. That allows stretching of the tendons and the nerves here on this side, which is where the median nerve is. And you can do the stretches in this direction, holding it for about 10 to 15 seconds, and repeat sets of 3 to 5. You can also stretch the other way, whichever way is easier for you. You don't want to stress the wrist at the same time, okay? Now, if your symptoms are severe, if you're involved in repetitive activities during the day, you may have to do this several times during the day, maybe every hour. Now, one last stretch that you may want to do, but you may want to do it slowly because this may trigger some numbness or tingling in the fingertips, is bring your elbows up straight, your neck back. Now, elbow straight, bring your wrist back, and also spread your fingers. And this, for some people, again, is one of the more advanced stretches and could cause some tingling. So you may want to take that slowly. Now, what else can you do on your own? So you can wear braces at nighttime or when you're doing activities that trigger your symptoms. There are many different kinds of braces, but the main purpose of them is to hold your wrist in a neutral position like that and prevent your wrist from being in extreme positions of flexion or extension. And you don't want something that's going to cause tight compression. So wearing a tight elastic wrap around your wrist is not a good idea. You want to have something that's comfortable, something that has a lot of cushion and allows your wrist to be somewhat in that static position. Now, finally, another option is surgery. And I personally recommend surgery to those with severe objective findings, such as muscle atrophy, wasting of the muscles on the hands that I see on the exam, or severe nerve conduction findings. And the surgery consists of releasing the roof of the carpal tunnel, which is the thick ligamentous structures that I mentioned earlier. It is a very quick and successful surgery. It takes about 10 minutes. I make an incision in the palm, here in the palm, about an inch long, and spread the tissues around, visualize the ligament fully, and then release it. Once I make that release of the ligament, then the structures inside the carpal tunnel do open up and allows the nerve to be decompressed. After the surgery is done, you'll have 3 to 4 stitches and a small Band-Aid type of dressing. And after 3 to 5 days, you can start washing your hands and the sutures come out in 10 to 14 days. Okay. Now, I do see that there are some questions that are coming in, which is great. I am now going to go ahead and respond to some of the questions that were collected earlier on our Facebook page and also from other online social media platforms. This is a question from Michelle M. And she asked, "Hello, Dr. Park. I put off getting my hands and wrist examined for a long time. I finally had an EMG scheduled, but I was canceled due to the pandemic. I'm in so much pain and my hands are useless due to the numbness and pain. Any suggestions for maintenance relief while I wait?" So Michelle, so this is great. You just sound like me. You know, I tend to put things off until it's really bad. So, but this is an excellent point because sometimes the scheduling does not allow to do surgery right away. So sometimes we may have to wait. The very important thing that we have to do first is the diagnosis. And as I mentioned before, the diagnosis is a combination of physical examination, the history of your symptoms, and the EMG finding. So given the circumstances that we're in, if you have not started it yet, definitely start with the stretching exercises, wear a wrist brace, and at least that's gonna mitigate some of your symptoms. And hopefully, by the time that this is all over, we can get an EMG. The other thing that's important, Michelle, is to make sure that your symptoms are from the carpal tunnel syndrome and not from anything else. So if you're not yet examined by a hand surgeon like myself, I absolutely recommend that you get evaluated with an X-ray and the physical examination to make sure that's the only thing that's causing your symptoms. Okay. Next question comes from Bonnie D. And the question is, do I have to have anesthesia for carpal tunnel surgery? That's a great question, Bonnie. And this has been something that has changed a lot in my practice over the last 5 years. And what I have been doing in the last 5 years is doing this type of surgeries under just local anesthesia with the patient wide awake. It is just like going to the dentist, but the difference is that you can actually talk during the procedure. I hate when my dentist talks to me and all I can respond back to him is uh-huh. I don't even want to nod or shake my head because I don't want him to be drilling the wrong tooth. But this is absolutely not the case with the carpal tunnel surgeries under local anesthesia. There's so many benefits of it. You don't have to suffer from the bad side effects of the anesthetic drugs. There's no need to undergo extensive preoperative blood work or testings. And you don't have to fast the night before. And you can even drive yourself in and out of surgery. And most importantly, we'll get to chat for a while, get to know each other a little more, and also hear the bad jokes that are said in the OR. Another question is from Karen C. Would like to know if there are any supplements or medicine that are useful to address carpal tunnel. Hi, Karen. This is an excellent question. I get this a lot, and I have to tell you that as physicians and scientists, we have to base our recommendations on evidence-based medicine. And the truth is that there's no strong enough evidence to suggest that any oral treatment has any benefit to carpal tunnel syndrome. And there were studies that studied diuretics, gabapentin, even NSAIDs, pyridoxine, and other oral drugs, and they do not make a significant impact on the carpal tunnel syndrome. Having said that, if there are no contraindications, and if you want to try some over-counter NSAIDs, I'm not opposed to it. It is relatively safe drug to try, so that's okay. But there's no scientific proof that any of those medications do make a significant difference for carpal tunnel syndrome. Next question that I've been collecting is from Rhiannon D. She asks, what is the expected recovery time following the procedure to fix carpal tunnel? Would I be able to work right away using my affected hand? That's an excellent question. Once people decide to undergo the surgery, that's a next logical question because they have to plan their work schedule around. And it's all relative. It depends on the type of work that you do. You can start light activities right away. Remember, you only have almost like a Band-Aid type of dressing after a surgery. So if you have a very light desk job, you can even return on day one. After 2 weeks, when the wound is fully healed, there's no hard restrictions, and you can basically return to your activities depending on your symptoms. You may have some scar pain, and that severity of the scar pain varies, and you could sometimes, depending on the line of work, if you're working on carpentry or construction, It may take several weeks or maybe months, but you're not restricted from doing stuff like that. Okay. All right. So now I'm going to answer a question. This is from Jake H. He asked, I was diagnosed with carpal tunnel syndrome 5 years ago and was told that it is only mild based on the EMG. My symptoms are somewhat manageable. Am I doing more damage by waiting? When should I consider surgery? This is an excellent point because sometimes the symptoms are not too bad and you go the route of seeing the doctor and then you get the EMG and they tell you you have the carpal tunnel syndrome. So I would say, Jake, that if your symptoms are manageable, it is okay to wait. But also pay close attention to your symptoms and the progression of your symptoms. For example, if you have a hobby like riding a bicycle or riding a motorcycle, pay attention in terms of when you start to get the numbness. If you used to get the numbness after riding for an hour or two, and now it's getting it when you're riding only for 10 to 20 minutes, that's a sign of progression. For women, I hear that they usually get the symptoms of numbness and tingling when they're putting makeup on, using a blow dryer. And now if you have to take frequent breaks because of those things, you know that things are progressing. So pay closer attention to things like that to be evaluated. Okay. Now I'm gonna. There's some questions from the live audience here. So thank you. So this is from Rebecca N. Can carpal tunnel worsen or develop during pregnancy? And this is absolutely true. Yeah, it absolutely happens. And I'm gonna say that my wife is currently pregnant, but when she was pregnant with our first child, she did develop a lot of numbness and tingling, and that is something that happens and many times goes away after you deliver the baby, and that has to do with the fluid shift that happens during pregnancy. You retain more fluid, and remember the anatomy that we talked about, where you have a very confined space, and if the volume inside that space, because the fluid retention increases, then the carpal tunnel, it worsens because the median nerve is still in that space, but it is being somewhat squished because of the swelling. So it could happen, and typically it goes away once you deliver the baby. But if it does not, and if it persists, then we can do other things, and definitely stretches and the use of the braces are a great option if you develop it during pregnancy. Next question that I have from the live audience, this is from Patricia W. What if you have RA, rheumatoid arthritis, and the pain in the wrist and hand are horrible? Yeah, so Patricia, this is an excellent point because carpal tunnel syndrome is a very common terminology, and it's a term that gets used a lot throughout the community, throughout the non-medical community, and sometimes when people have pain, they always say, "Oh yeah, it must be carpal tunnel syndrome," but that's not always the case. So I think if you have other coexisting medical conditions like rheumatoid arthritis, you do have other reasons that could make the pain worse. Okay, you could have some changes, some bony changes, arthritis that affects on the wrist or even on the fingers, which is one of the hallmarks of the rheumatoid arthritis that could make things worse. One thing that's particular in rheumatoid arthritis patients is that, like I said before, inside that tunnel, the floor and the sidewalls are defined by the bony structures. And now if you have bony spikes and spurs from the bone spurs, that could cause actual physical irritation on the nerve or the tendons. So that is a particular case in rheumatoid patients. So this would be a case where I would need more of an extensive workup, such as X-ray, maybe even a CT scan and an MRI, in addition to the nerve conduction studies if I'm suspecting that there's a bone spur that might be aggravating your symptoms. So the excellent point, but I think in your particular case, Patricia, I think we may have to do some more testings. Okay. All right, great, thank you. Now the next question is, this is from Elana B. Can carpal tunnel come back after the surgery? This is an excellent point, and um, it's possible. I wish I could say that it's never possible, um, although it's very, very rare. Like I said, I have been with Bucks County orthopedic specialist for 7 years, and knock on wood, I don't recall anybody that I had to do again because of carpal tunnel syndrome came back. Having said that, every now and then, I would say maybe a handful a year of patients had carpal tunnel released decades ago, 10, 20 years ago, and now the symptoms came back and they undergo revision surgery and do well. But the other thing that could be possible is that um, sometimes there might be other conditions that could cause nerve symptoms. For example, patients with diabetes, they have something called neuropathies, and they get decreased sensation in their hands. They could also have issues with their cervical spine, and the cervical nerve roots might be pinched and could completely mimic the symptoms of the carpal tunnel syndrome. So that those type of issues could also they need to be studied before undergoing revision surgery for something like that. Okay. Um, I have another question from Patricia again. So, Dr. Park, what causes carpal tunnel syndrome when you have rheumatism? When you have rheumatoid arthritis, the cause of the carpal tunnel syndrome, the most common reason that people get carpal tunnel syndrome is because the ligament, which is a roof, and right underneath the roof, that's when you have the median nerve, is being pressed because the ligament is becoming thicker and less pliable. Okay, so it's usually the ligament that's the culprit here. But as I was alluding before, sometimes you could have, with rheumatoid arthritis, you could have even the floor or the side walls, which are the bony structures, protruding into the tunnel and making the tunnel smaller. So that could effectively decrease the volume inside the tunnel and cause that nerve to be compressed. So that is also one of the possibilities. There's no one simple reason why you could develop carpal tunnel syndrome, but those are the two most common causes. Okay. All right. I have another question from Bonnie D now. Do you have to do therapy after a surgery? And this is an excellent point, and this is something that our hand surgery literature has looked into. And the current recommendation is that we don't have to do routine therapy after the surgery. However, I do send some patients to therapy afterwards, and the reason is because not everybody recovers at the same rate, and if they're having some difficulties or if they have some more sensitivity over the scar or more difficulties moving their fingers, I do send them to physical therapy, but not on a routine basis. And I have to say, I don't have my own statistics here, but just on top of my head, I would say that probably 95% or more do not go to a physical therapy. They just do exercises on their own. And the exercises after the surgery are not too hard. And those are the things that we would demonstrate you during the post-op appointments, and it'll be something just to rub along the incision, rub on the scar, which helps with the scar sensitivity, so makes it desensitize that area a little better. Moving your fingers up and down, stretching it, and again, remember that because you don't have a big splint or big bulky dressing after the surgery, it is recommended that after the surgery that you do move your fingers up and down. And starting to get the motion going from day one is the best thing you can do to recover from the surgery. Okay. All right, I have one more question here. So this is, okay. All right, so I think that's probably everything that I've been all the questions so far. But at this point, I think it has been about 25 minutes, and I think that's probably good timing. So let's wrap things up. And I just want to thank everybody for joining me and listening to my very first Facebook Live event. And before I go offline, I want to put a plug about our telemedicine visits. We at Bucks County Orthopedic Specialists, we are open and we're physically seeing urgent and emergent patients in the office. Otherwise, we started the telemedicine visits this week. This may be the future of medicine. So far, I've had more than 10 patient interactions via telemedicine, and it has been quite successful, in my opinion. I was a little skeptical at first because I rely a lot of my diagnosis on the direct physical examination, but sometimes the quality of the camera tells a lot about the patient's conditions. So I gotta say, it has been a pleasure, to be able to get to work by taking a few steps.
Can you do both hands at one time?
Okay, and it has been quite good. So like, if you're out there and if you're wondering and if you want something more of a personalized, chat with me or with any other specialist, please feel free to call us. And before I hang up, I just had another question from Jackie N. And the question was, can you do both hands at the same time? And the simple answer is yes, you can, but you probably don't want to do that because even though the recovery is quick, you don't want both hands to be incapacitated at the same time. So you do want to have one hand that you can use for both hygiene issues or anything that you need to do while one hand recovers. So I typically stage them, and the timing is usually at least 2 or 3 weeks between each other to see how one hand is doing before you decide to do the other side. But that's an excellent question, something that I also get a lot too. So I wanted to tell you that again, if you're interested in doing these televisits, please call our office. It's 215-348-7000, and it is just a phone call away. It is just like a regular office visit. You'll be given a certain day and time, and just before that scheduled date and time, we will email you or text you a link, and you just have to click on the link, and then you'll be connected in a one-on-one video chat like this. Okay, we'll be able to diagnose some common problems and formulate a personalized plan based on your particular condition and circumstances. Please, we're only a phone call away, so please call us. Thank you very much again. This is Dr. Jung Park signing off, and have a wonderful day at home with clean and now healthy hands. Thank you.